Hello everybody, I am Dr. Chinmay and I am a retinal surgeon at Aditya Jyot Eye Hospital, Mumbai, and today we are going to discuss about a condition called diabetic retinopathy. So as we know, what is diabetes really? It's a disorder in which the body's ability to produce or respond to a hormone called as insulin is impaired. So this results in increase in blood sugar levels and a lot of effects in various organs of the body. So when diabetes starts affecting the eye or the back portion of the eye, which is called the retina, that condition is called as diabetic retinopathy. Now, how much is the burden of diabetes? So if you talk about India, India has about 61 million diabetics who are between 20 to 80 years of age according to the IDF, and this number is only bound to increase. So by 2030 we estimate that more than 100 million people would be diabetics in India. So worldwide, out of an estimated 422 million people with diabetes, around 1/3 of them, so more than 100 million throughout the world, have signs of diabetic retinopathy, and out of these 1/3 more would have diabetic retinopathy which is visually threatening, which means that they can actually lose sight due to some complication of diabetes. So this is something which is emerging as a pretty much preventable cause of visual loss, and it is receiving attention throughout the world. Now, what are the risk factors for having diabetic retinopathy? Obviously, the duration of diabetes. If you are a diabetic for more than 10 years, you are anyways at a risk of having eye complications due to diabetes, and on top of that, if you are not very nicely controlled, if your blood sugars have always been fluctuating on the higher side, then that's again a risk factor. In women, pregnancy can kind of hormonally predispose your body to increasing the level of diabetes in your body and increase the impact of diabetic retinopathy on your vision. In addition to this, blood pressure, kidney problems, high blood cholesterol, habits like smoking and low hemoglobin, and if a person is very obese, so these are all the risk factors which can predispose you to having diabetic retinopathy. So what are the stages of diabetic retinopathy? What happens in diabetic retinopathy? Do you go blind immediately? Well, no, that doesn't happen. It passes through different stages. So there's a non-proliferative stage and there's a proliferative stage. Non-proliferative is the initial stage. It starts off as a mild, moderate or severe. So what are these mild, moderate, severe? So the first changes which happen in the retina, which begin with the non-proliferative stage, is when you see small, you don't see it but your doctor can see it, small spots of blood on the surface of the retina. These are called microaneurysms. So they are the first signs of diabetic retinopathy. If they increase, they might lead to more hemorrhages being there on the surface, or they might lead to leakage of blood products and cholesterol inside the retina, which are called exudates, and the retina might also be swollen up. So this is how on my screen, if you see, they are the changes of diabetic retinopathy. You can see certain small discrete red dots, so those are signs of hemorrhages on the retina, and those yellowish spots that you can see are the cholesterol deposits which are there in the retina. And when this non-proliferative condition goes on progressing, it might eventually cause a condition, it might turn into a condition which is called as a proliferative diabetic retinopathy. Now this is one of the visually threatening forms of diabetic retinopathy. Why? Because it leads to the formation of certain fragile abnormal vessels which can bleed, and they can cause blood inside the eye. Now this blood inside the eye might cause a very dramatic or a very sudden loss of vision. A person might be seeing something yesterday and today he might be completely blind, and that's how it looks like. So there is a large blotch of blood, if you can see on my screen, on the surface of the retina, and this is always very sudden, and it's all emotionally very distressing to the patient that yesterday he was seeing all fine and today he is almost blind. And in advanced stages of diabetic retinopathy, there is something which we call as a tractional retinal detachment. Now what does this mean? This means that the retina is pulled apart because of certain scar tissues and certain products of the degenerated blood. The retina gets pulled apart. If the retina gets pulled apart, that's called a retinal detachment, and this can lead to a very profound and a very sudden loss in vision, and this is one of the complications which can lead to irreversible blindness. So this is something which we need to prevent. This on my screen, if you can see, there's a lot of blood, and there's the whitish looking tissue or scar tissue, and that's led to a retinal detachment. And a second condition is diabetic macular edema. Now macula is the structure in the center of your retina. Now that particular part of your retina is very important for your vision. In diabetes, what can happen is that part can get swollen due to the leakage of blood and fluid in that area. So if that happens, then the vision goes low. So this is again one of the causes of poor vision in diabetics. And all of this can somehow be prevented. Now what do you have to do for prevention of these visually threatening complications of diabetes? Obviously, the first and foremost thing is to keep your sugar levels under control, to have a good check, visit your diabetologist regularly, make sure your food and diet habits are in sync with what you have been advised, and keep the sugars under control. And all diabetics, irrespective of whether they have any eye symptoms or no, should undergo a dilated retinal examination at least once a year. So that's what is recommended, because if we can catch you in time and treat you in time, then that prevents any permanent loss of vision. So early detection and timely treatment and appropriate follow-up are like the benchmarks, or are like the cornerstones of preventing vision loss due to diabetes. Now what happens when you have diabetic retinopathy? In certain severe cases, there might be a laser treatment, retinal laser, which is required, and we do this to limit the further progression of diabetic retinopathy, so that whatever vision is remaining can be salvaged nicely. And in cases where there is a lot of blood inside the eye, or the retina is detached and the vision loss is very profound, such advanced cases might also require retinal surgery to restore vision, or to keep the vision stable as to where it is. Thank you.